All right, so I just come out of my patient Jen Eric's room. It's 8 o'clock in the morning. It is time for her IV antibiotic medication. So on her MAR here, it says that she needs cefazolin, 1 gram. So I will go into the med room and I will pull out my medication, cefazolin, 1 gram. My first check, it's not expired till 2025, so that is good. The next thing I will do is just check with my IV monograph, what it's compatible with and how much I need to dilute it with. So I've got 1 gram, and I know for intermittent infusion, I need to dilute it in 50 to 100 ml mini bag, compatible with normal saline, which is what I have here. So that is good. And so the next thing I can do is just prepare my medication. So I will perform hand hygiene first. All right. Alcohol swab at the top and do the mini bag as well. And then I will use my reconstitution device. Okay. I'll mix the medication. Just mix it up. All right. Oops. Oh my gosh. Hopefully this wouldn't happen in real life. I didn't leave a big enough air bubble, so it's not really going in properly. And in real life, I would never leave any medication left in the vial, but just for the video's sake, I'm going to just go with that. So before I remove that, I will move on to my, my 7 rights. So I have the right patient, which is Jen Eric, the right drug, cefazolin, double check that, cefazolin, right dose, 1 gram and 1 gram, right route, IV, right time, it is 8 o'clock, which is right about now, right reason, she's got an infection, it's an antibiotic, and right documentation. I will dot my MAR. Okay, and my 3rd check, I will take this out and just confirm again, cefazolin not expired, so then I would put this into sharps. The next thing I will do is put on a label. All right, so because I'm not using a pump, I have to calculate the drip rate, so I'll do that by however many mils are in my mini bag, so 100 mils. And I am to infuse this for 20 minutes, so divided by 20 minutes times my drop factor, which was 10, equals 50 drops a minute. So I will have to calculate that when I get into the room. I'll do another hand hygiene and then I'm ready to go to the bedside. That alcohol swab and my mark. Hi Jen, I'm back.
Hi.
I'm just going to set you up for your IV medication this morning.
Okay.
And can you tell me your first and last name?
Jen Erickson.
Okay, and your birth date?
March 22nd, 1982.
Okay, do you have any allergies, Jen?
Nope.
Okay. So what I will do now is I will just have a look at the IV site just to ensure that there's no swelling or redness or blood anywhere. There's not, so I don't have to use any gloves. All right, so I've hung my medication. Next thing I will do swab that, and then I'll do a flush. Okay, Jen, I'm just gonna flush your IV with some normal saline.
Okay.
You're gonna feel a little bit of maybe cold fluid going through there, so just let me know if there's any discomfort. It's unclamped. Okay. And we did an IV flush. All right, so the next thing I will do is just set up my bag. So I'll take an alcohol swab. Swab the port, and this primary line would have come out of a sterile bag, so it's technically sterile. But I'll give that a swab. Okay, the next thing I'll do is just prime my primary or my secondary line with the primary. So okay, and I don't see any more air bubbles. So then I can spike it. And connect it. This would have a sterile cap on it normally. Okay, so I can unpinch that. And that one. And then I will slowly count my drip rate. So I need 50 drips a minute. So I'm just gonna divide that in half and do 25 drops in 30 seconds. And it's been 30 seconds. Okay, So now my infusion is going, and I will tell my patient Jen that I will be back in 20 minutes to check on you when this is finished and just to ring the bell if there is any feeling of discomfort or feeling unwell.
Okay.
And then I will grab my MAR. And sign that I've given her the medication.